What are the different types of heart murmurs in dogs with congenital heart defects? Have you ever wondered what those unusual sounds from your dog's heart might mean? Heart murmurs can be a sign of congenital heart defects, which are structural issues present at birth. Understanding the different types of murmurs can help you and your veterinarian identify potential health concerns. Heart murmurs in dogs are abnormal sounds caused by turbulent blood flow within the heart. When it comes to congenital heart defects, the murmurs vary based on the specific defect and how blood flow is disrupted. The first type is systolic murmurs. These occur during the heart's contraction phase, known as systole. Systolic murmurs are the most common type in dogs. Loud systolic murmurs, graded 3 out of 6 or higher, often indicate significant abnormalities. For example, pulmonic stenosis is a narrowing of the pulmonary valve or artery, causing turbulent blood flow as blood is pumped to the lungs. Another example is subaortic stenosis, which is a narrowing below the aortic valve that obstructs blood flow from the left ventricle to the aorta. Ventricular septal defects, or holes in the wall between the left and right ventricles, also cause abnormal blood flow and turbulence. Next, we have continuous murmurs. These are heard throughout both systole and diastole, which is the relaxation phase of the heart. A classic example of a continuous murmur is patent ductus arteriosus. This defect involves a persistent opening between the aorta and pulmonary artery that should close after birth. The result is continuous abnormal blood flow and a characteristic murmur. Diastolic murmurs are another type, although they are less common. These murmurs occur during the heart's relaxation phase and may be associated with congenital valve abnormalities or severe defects affecting blood flow into the heart chambers. It is also important to note that innocent or physiologic murmurs can occur in young puppies during rapid growth. These murmurs are typically low-grade and transient, disappearing by 6 months of age. They are not linked to congenital defects. Murmurs are graded on a scale from 1 to 6, with 1 being very soft and 6 being very loud. Generally, louder murmurs indicate more significant defects. If a young dog has a loud systolic murmur, a persistent soft systolic murmur, a continuous murmur, or any diastolic murmur, it strongly suggests a congenital heart defect and should prompt further diagnostic evaluation. Common congenital heart defects associated with murmurs in dogs include patent ductus arteriosus, pulmonic stenosis, and subaortic stenosis. Each defect produces distinct murmur patterns that help veterinarians diagnose the underlying condition and decide on treatment options. Identifying the type and timing of the murmur is essential for assessing the severity of the defect. This information helps plan diagnostic tests such as echocardiography and determine the best intervention to improve the dog's quality of life. Early detection of congenital heart murmurs can guide timely management and improve outcomes for our furry friends.